All right, so the next topic we're going to cover is something called diaphragmatic breathing. So that's just a really long way of saying belly breathing. What this is a method of breathing into a 360-degree canister in our stomach, into our sides, and into our back. Oftentimes, a lot of humans are chest breathers, so we're using our upper traps, our scalenes, our intercostal muscles in between our ribs to do a bulk of the breathing for us, when in reality, the primary breather muscle that we're supposed to be utilizing during respiration is our diaphragm. So our diaphragm sits tucked up underneath this rib cage here, and it moves up and down. As we take a deep breath in and our lungs fill with air, that diaphragm goes down, and as we exhale and release that air from our lungs, the diaphragm will move upward. So a lot of times people aren't properly accessing this muscle during respiration. We're taught to suck in throughout life. We have poor posture. A lot of things can contribute to why we are not respirating as efficiently as possible, which can lead to chronic neck pain, upper back pain, headaches, you name it. Everything's connected. I'm a big kinetic chain believer. And so this video is just going to touch a little bit on how you can train belly breathing. So the first step with my patients that I go down is I have them go ahead and lay on their back with their knees bent. So I'll go ahead and do this and talk you through it. So with belly breathing, what we're going to focus on here is we're going to rock our pelvis forward and back, and we're just going to find that nice neutral place for it to reside. We don't want to be too arched where that low back isn't in contact with the ground, but we don't want it to be super round either where our bum comes off the ground. So find that nice neutral pelvis, and then what I want you to do is take a deep breath in, blow that air out, and as I blow that air out, I want to make sure that rib cage is tucked down and it's not arched up like so. Bringing that rib cage down is going to allow us to stack that diaphragm over that pelvic floor, which just basically is going to allow us to do this belly breathing in a more efficient manner. From there, I want you to go ahead and take one hand, place it on the chest, one hand, place it on the stomach, and we're just going to focus on breathing into that stomach hand. So take a couple of deep breaths here. It's going to feel a little foreign at first, and you might feel a little winded. That's to be expected because we're not used to engaging our stomach in this way. We're so used to breathing up here into the chest. So one cue that I like to give my patient is don't focus so much as I want you to stick your belly out. I want you to just think about relaxing the abdominal wall, getting those muscles to turn off that have been so hyperactive throughout life. So go ahead and take a couple breaths here. As we get better at this, what I want you to focus on is not just breathing into this forward position of our belly. I also want you to focus on breathing into the sides and into the low back. So if you watch what I'm doing here, I'm going to progress from moving forward, sideways, and back. And the thought process is I just want you to think about breathing into the full belly here. Our lungs aren't in our stomach. So when I say breathe into the stomach, that's not what I'm getting at. When I say breathe into your stomach, I mean activate that diaphragm, which will flatten down, increase the pressure in that abdomen, which will in turn appear like that abdomen is inflating. So take a couple deep breaths here and work through this. Once you get more comfortable with this, we can prop the legs up against the wall and keep them at 90, take some of that pressure off the low back. We can do this in the morning when we wake up, we can do it before bed, and we can do it as a form of micro breaks throughout our day when we're sitting all day. Diaphragmatic breathing and belly pressure are two different things. We'll get a little bit into what belly pressure is, but as we are able to increase pressure in the stomach by utilizing our diaphragm, we're actually increasing pressure, which is going to push up against that spine, that low back, and it's going to create some stability for that low back. So this is a tool that I like to use for all of my patients because it is very important. It can influence the whole body, but especially those patients with low back pain, because this is going to help create stability for that low back. If you have any questions, let me know. Give it a shot.